So, my dear colleagues, I would like to present to you the legal context of the regulation of plastic surgery and cosmetic medical acts in France. So, the ethical foundations of the regulation of plastic surgery in France and cosmetic medical acts is based on the French Medical Code of Ethics, which stipulates that the doctor should in no case act beyond his powers and experience. And this medical code of ethics stipulates also that medicine is not a business, and it bans direct or indirect advertising for doctors. It is also based on the French Constitution, which introduced recently the precautionary principle, and also on a duality between the traditional paternalistic model of interaction between doctor and patient and a new deliberative model of interaction based on fully informed and free consent of the patient. History of regulation of medical acts, of cosmetic medical acts in France begins in 1988 when a judgment of the French Council of State, which is the Supreme Administrative Court, confirms the conviction of a physician performing aesthetic surgical procedures and who was not specialized in plastic surgery. And this judgment was based on the French Medical Code of Ethics. Then in 1996, a ministerial ruling makes the cost estimate compulsory for all cosmetic procedures costing 300 euros or more and for all the cosmetic procedures done under general anesthesia. But the main turning point in the history of regulation of plastic surgery is in 2002. It is the law of 4 March 2002, which introduces a new chapter in the Code of Public Health relating to plastic and aesthetic surgery. And this law makes compulsory a precise and complete information on the benefits and risks of medical cosmetic procedures and a price quotation for all surgical cosmetic procedures. Also, an incompressible reflection period of a minimum of 15 days for surgical cosmetic procedures. The accreditation by administrative authorities of health clinics in which surgical cosmetic procedures takes place, and the only practitioners who are authorized to perform surgical procedures, cosmetic surgical procedures, are qualified and aesthetic surgeons for all cosmetic surgical procedures, qualified maxillofacial, ENT, stomatologic, ophthalmic, gynecologic, and urologic surgeon for cosmetic surgical procedures in their own specialist fields. And advertising is prohibited for these clinics. So now let's focus on plastic surgeon training and qualification. There is a diploma in France, which is the Diploma in Specialized Complementary Studies in Plastic, Aesthetic and Reconstructive Surgery, the DESC of Chirurgie Plastique, Reconstructive et Esthétique, which allows an exclusive practice of plastic surgery. And plastic surgeons are the only surgeons who have the legal ability to perform all plastic and aesthetic surgical procedures. The training is made up of 6 years of general medicine and 5 years of surgery, including 3 years of specific training for plastic surgery, and 1 to 4 years of practice as a senior surgeon at the public hospital. Now let's focus on laser depilation. There is a constant jurisprudence in France that laser depilation is a medical act. Laser removal of body hair must be done by a physician or under his watch and responsibility. And there is a ministerial ruling of 1962 which stipulates that, and then another ministerial ruling of 1974. And there are many judgments of the Supreme Court in France, which is the Court of Cassation, and the Supreme Administrative Court, which is the French Council of State, that stipulates that. And it is also, this law is also for the IPL. The use of botulinic toxin and hyaluronic acid in France. Well, the use of botulinic toxin for cosmetic purpose is only allowed for qualified plastic, maxillofacial, ENT, and ophthalmic surgeons, and for dermatologists. And there are many condemnations of the French Medical Board for the use of botulinic toxin by other practitioners. However, the hyaluronic acid is currently available in France in drugstores without prescription, and there is, in fact, no restriction for its use, aside from the instruction manual, which stipulates that the hyaluronic acid must be injected by an authorized medical practitioner in accordance with local applicable regulation. Now for breast implants, we will shortly have a national register of implanted breast implants, which will give us a follow-up of complications and which will give us also effective warnings for new risks. Advertising. As I told you before, direct and indirect advertising is prohibited for doctors and medical clinics in which cosmetic surgical procedure take place. But there is no direct restriction of advertising for web platforms, aside from doctor personal websites. But there is an implicit and indirect restriction of advertising for these web platforms, because it is an indirect advertising for practitioners, which is prohibited by the Medical Code of Ethics. What are the advantages and disadvantages of regulation in France? Well, the advantages are it is a very protective regulation of cosmetic medical acts, and there are only a few qualified surgeons who have the legal ability to perform plastic and aesthetic surgery procedures. It is very protective for our patients. And this is really an important point of the regulation of cosmetic medical acts in France. The main disadvantages are that there is no advertising is allowed. Even patient testimonies are prohibited on professional websites. And the main risks for doctors in France in 2017 is that web platforms may Uberize doctors and surgeons, because web platforms are allowed to have advertising. What is the role of professional organization? There are three important organizations for plastic surgery in France. Two are scientific organizations. It is the SOFCPRE and the SOFCEP, Société française de chirurgie plastique, reconstructrice et esthétique, et Société française de chirurgie esthétique et plastique. And they give a list of qualified surgeons on their websites. And there is also a partnership between the SOFCEP and the ISAPS. The SNCPRE is the Plastic Surgeons Union. It is a syndicate, and it advocates for the profession, and it takes care of the legal aspects. So now, how to encourage the public to go to fully certified professionals? There are two aspects of these questions. I think there is the communication aspects, and there are the legal aspects. Dealing with the communication aspects, it is important that each of us, each of the professionals who works in and who make cosmetic medical acts have a professional website. And it's important that we make educational videos for our patients. And this communication aspect is really encouraged by the French Medical Board, aside from advertising and aside from self-promotion of the professional. Dealing with the legal aspects, it is in fact the role of the syndicates to take care of these aspects, so especially the SNCPRE and SNDV. Now, how can a qualified practitioner protect his own interests and those of his profession simultaneously? What are the main risks now? The main risks in the next 10 coming years are the deregulation of medical cosmetic acts and the Uberization of certified practitioners by web platforms. In fact, there is no duality between protecting our individual interests and the profession interest, and protecting the patient interest, which is our first objective as a doctor. It is important to get focused on these main problems and the main problems we are going to face, and not to be divided. And it's important to keep in mind that connected digital medicine and telemedicine are the next revolution, which will deeply remodel our practice, as deeply as the web did 15 years ago. Thank you for your attention. So you just have to keep in mind that life is a matter of anticipating risk. So we have to face these new risks and just jump to the next revolution.